it was unbearable. I couldn't go about my daily chores. I couldn't work. And I just felt...
What was wrong with you?
I'd had surgery 5 years prior to that. I had a discectomy, which became very infected, but I must say that was in Holland. I was in bed for most of that year. I was in bed flat on my back for 5 months. But my back did improve and I didn't have problems, and then about a year ago I started experiencing pain again and numbness down my left leg, and by January it was just so unbearable. I went to see my GP, who then wrote to a consultant to refer me. He didn't give all the information that I had given him about the infection and what I'd been through before. And we waited and waited, and we got no reply from the hospital acknowledging that we were even on the waiting list. I then on television saw that Bupa offered a back assessment for £100, which I went and had done. And the consultant I saw there recommended that I have an X-ray, which I had done, all paid for by myself. And he said that definitely there was a narrowing around the nerve. It was pinching the nerve.
In your back?
Yes.
The disc?
Well, yeah, where I had my previous surgery. It was scar tissue from the previous surgery. But he said in order to see the magnitude of the problem, I'd need an MRI scan, which I said to him, how long do I have to wait for that? And he said on the NHS, 3 months. Which I wasn't prepared to do. So I took the £580 and went and had a scan, an MRI scan.
So you paid £100 for the Bupa assessment.
Yes.
How much for the consultants?
£150 for
Another
the first
150.
consultation.
£50?
Yes, and then I paid £83 for the X-ray.
Right.
And then £580 for a scan.
The scan.
Yes, and he determined that the problem was chronic, that he would need to do surgery, but he could only guarantee me 60% chance of being pain-free. But at the same time, I was paging through my local paper and I saw an advertisement for European medical care, and I decided to ring and find out, you know, what the situation was. And the gentleman I spoke to, could give me an appointment to see one of the top surgeons in Belgium within 3 weeks, which I said I'd like to see him to get a second opinion. And he had a look at my scans, but the nice thing about him was he didn't treat me as though I was an idiot. Where when I saw the consultant at Bupa, I asked him questions about the scan, things that I'd seen on the scan, and he said, oh, you don't need to worry about that, you know, just don't worry about it, that's nothing. But when I was in Belgium, he actually took each slice of the scan and explained them to me. And he said, this is the problem, we can remove the scar tissue and free up the nerve, but we'll have to do the other operation to stabilise the spine and cover the nerve with a sleeve, a synthetic sleeve, and do bone grafts to avoid the scar tissue actually growing back. Right. Which, if I'd had it done here, in 2 years' time I would have been back in the same situation, same scar tissue. So, but he said, I don't want to do the surgery straight away. We want to first try something else to see if that is in fact the problem. So he put me in a plaster cast for 3 weeks just to stabilise the
all
spine.
of you?
Well, from there to my left knee. And,
I had this vision of you looking like a mummy. You put me in plaster cast. I mean, it sounded like the whole lot of you.
No,
top to toe. Particularly with a back problem, but okay, midriff.
Yes. Yeah. Well, to the top of the left knee.
Yeah.
And within 10 days, the pain had significantly decreased.
That's because you couldn't move.
Well, that is true. But after 3 weeks, I rang him up and I said, I've had a vast improvement. So he then booked me in for surgery, which I couldn't really afford. It would cost £7,500. But I just felt if I...
Did you have the surgery?
Yes,
I had the surgery. Did you pay the £7,500?
My parents, very kindly, who are pensioners, gave me the money to have it done.
And what's the total cost? 9,000 something or more?
Over 10,000.
Over £10,000.
Yes.
Was it worth it?
Most definitely.
Why should you have to go abroad?
I shouldn't have to.
Geraint, she shouldn't have had to do that, should she? This isn't you know, I was just going to say brain surgery, but we can do that as well. This isn't kind of rocket science. We do this kind of medicine on the NHS.
Yeah,
Why is she forced to relieve her pain to have to go and spend £10,000, but have money from her mother to get it in Belgium? Where the Belgians can do it, why can't we?
Yeah, no, we should be delivering major back surgery, and we are. I mean, the situation is that people can be expected to see their GP within 48 hours, to get the first appointment within 3 months and treatment within 6 months. In fact, there's only 31 people now who've waited more than 12 months, when a few years ago that was 30,000 people. And what's happening is more investments going in, people are being treated quicker. Obviously, I respect what Lauren says. She's seen by a GP in February, and she wanted an operation within a couple of months, and she paid for that.
Which is reasonable.
People have got the right to do that, but at the moment, we will guarantee 100% treatment within 6 months by 2005. At the moment, it's within 1 year, and we're getting, you know, 250,000 extra operations from foreign doctors who are coming here to clinical centres to deliver that.
Well,
it's not perfect,
but
ultimately, a lot of people like Lauren can sort of jump the queue if they pay. That's true. They
She's
always
not jumped
could.
the queue, actually. She's opted out of the queue. She hasn't jumped the queue.
No, but
Yes.
She's gone out of the queue. She hasn't been posed
No, but she would have been treated. But
let's be clear,
she wanted to be
jumped the
treated
queue.
within a few months of seeing a
She
GP.
has reduced the
Right?
queue, hasn't she?
And
She's
she-
reduced the queue here. She's gone
Excuse me.
abroad.
That's her right, that's fine.
Excuse me, before I could even see a consultant, I was referred to the physiotherapy department for a back assessment.
That was a mistake. There are a number of mistakes in Lauren's case.
Yeah, but mistakes
there
are
are
happening
mistakes
every
being
day.
made.
Let her speak,
No,
Graham.
but I think it's
Yeah,
quite
but let her
fair.
finish what she's saying, Graham.
I would have had to go for an assessment for at the physio department. They would decide whether I had a problem and I could be referred to the consultant. That would be a further 3-month waiting period for an appointment at the consultant. And then I'd need a scan, which would be another 3 months waiting. So we're looking at 9 months already. And then when I knew I needed the surgery, I rang the secretary of the consultant that I would have been seeing, and I said to her, just let's cut all the red tape and that. Just give me an answer. What sort of waiting time am I looking at before I go to Belgium? What waiting time? And she said, to be honest with you, 12 to 18 months. And after I'd had the operation
so we're
done...
clear here. What I'm saying is, as a cast iron fact, is that at this moment in Britain, there are 31 people who've waited longer than 12 months after seeing an appointment.
And what Lauren is saying is a cast iron fact.
That
she was going to have to wait a year or 18 months. That's a cast iron. She's a cast iron person.
No, I'm saying she wasn't, because there's only 31 people who've been waiting longer than a year now. It used to be 30,000, and it's come down. It's getting better. Now, I can't... I'm not here to defend...
They massage the figures as well.
No, I'm not here to defend the individual case here, and obviously there's big problems in what Lauren has said, and I respect that, but the generality is the waiting lists are coming
Mike,
down.
why did you have to go
people
abroad then, Mike? Tell him.
always have a right to opt out.
I was referred to a specialist by my GP on the 1st of April this year. I have a letter dated October inviting me to go for spinal assessment at the end of November. That's before I get on any waiting list. And that's 8 months. And that's a fact. I have the letters here.
And you've got...
I've had an operation in the meantime. I've been to Belgium and had the operation. I'm on my way to recovery.
Well, that's not acceptable. That's why we're investing in getting these target times
You're
down.
right, it isn't acceptable. That's cost me a lot of my life savings. I'm now retired. I don't have much of an opportunity to top those up again.
How much did it cost you?
It cost me just under £10,000 to go to Belgium.
But
if
like
I had
Lauren,
the operation
you were
here
in
in the
pain.
UK, it would have cost me £15,500 privately.
Privately. But like Lauren, you were in pain.
I was in pain and I wasn't prepared to wait 2 years.
And
the specialist here told me the NHS waiting list would be 18 months.
Right.
And I wasn't even on it. I'm still not on it.
Right.
And
you had the operation more
2
or less
years
immediately.
of a degenerating condition, increasing pain.
Yes.
I wasn't prepared to do that. My family weren't prepared to do it either.
And you did the right thing?
I believe so. I'm well on the way to recovery now. I had excellent care through European medical services.
But you shouldn't have to do that.
Shouldn't have to do it.
This, again, isn't a pioneering
Country like
operation. This
Belgium
isn't a
can do it,
specialist.
why can't we? It's a simple question.
Chas?
And that's why we're employing an extra 40,000 nurses.
This 31 people that you claim are waiting 12 months. Now, why is it that I have 3,000 inquiries a year for people waiting longer than 12 months if you say there are 31?
What, to go
why
abroad,
is
you
it
mean?
that if you access the NHS queues on the internet for any particular consultant across the country, they're all claiming 359-day waits? Why is it the NHS claims there are 900,000 people waiting for orthopaedic surgery longer than a year? and yet you're saying there are 31. There's a big discrepancy in figures somewhere.
I'm saying between seeing the consultant, you'll see the GP, then within 3 months you should ideally see the consultant. Then between seeing the consultant and having the operation should be less than 12 months. And it's between that, there's about 31 people now, and you're mixing those up.
Lauren was...
You know, you just... Let's see the doctor then.
I mean, I'm a local GP, and what you are saying in theory is right, that 48 hours...
In theory?
In theory, yes. In practice, it is not. Because both the demand is so much that I'm sure physically it is not possible to see patients in 48 hours, in spite of our best efforts.
The GPs don't.
GPs, yes.
So the first hurdle isn't got over anyway.
I mean, we are trying our level best.
And what's your experience, Doctor, of the... You've now referred her to a consultant. How long is she going to wait? After she's got to you within the 48 hours, let's see, she's the one that we've... on Grant's theory, she got to you in 48 hours. Now, how long would I normally have to wait to see you,
normally,
Doctor?
if we do an urgent referral, and...
No, to you. How long would I have to wait to see you? Are you always engaged? Are you always on an answer phone?
Normally we try to, you know... I mean,
how long would I wait, Doctor, to see you?
5 days.
5 days? I don't want to wait 5 days to see a doctor. I'd have to wait 5 days.
No, because
and obviously you're exaggerating, because she probably is 7 or 8 days.
No, not really. If you
5 days. Okay, I've waited 5 days. Then how long am I going to wait before I see this consultant?
If you were below 5 years, I would have seen you same day.
Right.
But you don't come in that category.
I'm not under 5. Hang on, Doctor. So 5 days to see you. I've seen you. Oh, yeah, you're really serious, terrible pain. Refer you to me to consultant. From your experience, again, how long would I have to wait to see the consultant?
I mean, normally, unless it is a, you know, like there are certain categories fixed up.
How long?
It will take about 6 weeks.
6 weeks?
Normally.
Is that within your theory?
It's within 3 months,
within your 3 months.
Within 3 months.
Within 3 months.
Right, so
I mean, normally when we put the urgent faxes, you know,
And then how long to have the operation?
But that we cannot guarantee, because we haven't got any control over secondary care.
I was thinking you might have...
Yeah, but it
You're
will
talking
be
about
within
going
a year.
abroad. Should we have to go abroad?
To be within a year for the hospital.
I think the NHS has let me down personally. I have a medical every year at work, and on my medical this year they noticed that I'd gone deaf in my left ear. So the doctor, they advised me to go see my doctor. My doctor referred me to a consultant. I've seen the consultant 3 times since February. Last week, the last appointment I had, they told me that I've got to have an MRI scan to find out what the problem is, because it's just switched off, my hearing's just gone. I've lost all my lower range. So I have go for my regular appointments, they clear my ears. I turn up last week, they tell me I've possibly got a tumour. And that my MRI scan's going to take 40 weeks.
40 weeks?
40 weeks. Yeah. I've got the letter in my pocket.
So would you go abroad?
I'm going to Bupa.
Are you?
Yeah.
You're going to pay?
I am, yeah.
Are you insured?
No, my company run Bupa, but I do have to pay.
So you're going to... And how much are you going to have to...
£50 for the first initial.
So you're going to have to pay, and then what about if you need an operation?
I don't know.
40
I've got to see
40
weeks.
No, I agree. I agree that's unacceptable. And what we seem to be saying here is more money should be invested in the NHS. We should have quicker treatment, and that's precisely why there's 1p on national insurance. That's why these timings are being compressed down. As the doctor's been saying, it's not perfect. I'm not pretending it is. It's just a lot better than it was.
We've heard some quite heart-rending stories so far, but our experience, my wife Leslie's experience particularly, has been completely different. Leslie recently, in July, had an operation for a hysterectomy, which is obviously different to what we've been talking about. But within 2 months...
Does she want you to talk about this?
She knows me better. Give me 5 minutes.
You're breaking patient confidentiality here. I hope Leslie's all right about it.
I'm not a doctor, so I don't have to worry about it. But our experience has been completely different. Within 2 months of seeing the consultant, she was operated on. OK, I'm going to break some more confidences here, because Leslie's actually had 3 major operations in the last 3 years, haven't you? And on each occasion, our experience with the health service has been absolutely brilliant. I can't.
Hang on.
Where about you come from?
I had such pain, and I couldn't walk.
Yeah.
And so life had gone for me. At my great age, life had gone. And then I saw a little advertisement in a local paper, European Medical, a free call to Brussels, And they said, yes, 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 when would you like to come?
What for?
Today,
what operation?
for a hip replacement.
Right.
And,
Today, they said.
They said, when would you like to come? And so I said, well, let me sort out the transport because it was a bit complicated. And within 10 days, I was in the hospital and having my operation. And it was super. And the wonderful hospital.
Why was it super?
Clean, oh, so clean. And the staff had time for you, you know. Whereas, I mean, our hospitals, I'm not knocking our hospitals, but they are so, so busy. And yet, here is the answer. If you want to go abroad and have an operation, they can accept as many people as
How much did it cost you?
£5,899, I think it was.
And threepence.
No, I think it was around that price.
And that was for everything? For the accommodation and everything?
For everything.
And are you all right now?
I'm fine. I'll dance for you if you like.
Yes, well, that lady had That lady had £5,000 to spend to be able to go and do it. I couldn't. I had to wait 18 months and when I had my knee operation. And that was done a year ago and I'm still in pain with it and attending the hospital.
No, my son helped me out because I really didn't have quite the savings for, to pay it myself.
Well,
but my son helped me out and he said, go for it. And I said, yes, I'm going for it. And
no, I couldn't afford it, and my children haven't got that sort of money to lend me to have it done, so I just had to wait.
But you don't begrudge her going.
I don't begrudge her going if she got the money to go.
If she's got the money and she can pay for it.
That's right.
But, this is also a national health hospital, and so...
The Belgian one?
Yes, it's a national...
But then there's nothing to do with
and when I say national health, they will accept national health patients, I believe.
Oh, the Belgian NHS.
It's a Belgian NHS.
It's a Belgian
treats Belgians.
I paid because I chose to, because I wanted it done quickly and I didn't know about that.
Right, and you paid your own money and your son helped you, yeah.
Yes.
And there's nothing wrong with that, is it? We don't disagree with that.
Anybody who can pay for it to have it done, they're entitled to have it done. I would if I had the money, but I hadn't.
I had the same problem. I had my knees done, both my knees done in 1994 by an Australian surgeon in South Wales. And everything was okay until I went to Canada and I had a small accident, a couple of steps, 5 steps. I stumbled, caught my knee, and I thought I had just bruised it. I came back to Britain and I went to see the doctor, and the doctor referred me to the hospital in Cardiff, and they x-rayed it and this, that and the other. Oh, nothing wrong, I just badly bruised. So I accepted that. But it gradually got worse and worse.
So you ended up having an operation?
He ended up going, after 1994, you can say...
Where did you have the operation?
I had the operation done in Belgium.
And did you pay?
I paid.
How much did it cost you? You're together, aren't you?
Yeah.
How much did it cost?
With airfares and everything, about £10,000.
And was it worth doing?
Oh, definitely.
Do you think you should have had to have done that?
No.
Well, tell the Welsh MP. Yeah. Tell him. Why should they... How old are you?
No, I agree.
Wait, I'm 76 and he's 78.
And how old were you when you went to Belgium?
This year.
This year, right. So you shouldn't be... They shouldn't be travelling.
No,
Where do you live? Where do you live?
Can I say on this individual
They shouldn't be travelling. Seriously. From Cardiff.
I agree.
And they've paid in all their lives. And they've probably worked all their lives.
And
they shouldn't be having to go to a foreign country with a foreign language to get a simple operation.
No, that's right, And may I say on this point that NHS does 4 million operations a year, and we're going to be doing an extra 250,000 this year with foreign doctors brought from France and Germany, Holland, to Britain to do these operations on hips, on cataracts and all the rest of it as additional operations, so these people don't have to travel from Cardiff abroad, but they will get that treatment as additional treatment in the NHS because people are paying extra tax for it.
Can I ask you why, at our age, we haven't got 18 months or 2 years to wait on a list?
No.
We haven't. This
Time's precious.
You know,
Time is precious.
right. And
I mean,
that's
if
why...
he'd have waited, he's going to be 80.
No, no, I
before,
agree
he would have
completely,
been
yeah.
80 before
No,
he
no,
was
I
done.
agree.
And
I
these
agree.
are 6 years of...
Yeah, give us a date, mate. That date, and it's supposed to happen then. And we'll
Yeah.
take you at your word.
Yeah.
It's
No.
supposed to happen whenever.
I'm saying now...
You just told me you're going to bring people over to do it. Now, give me the date.
I'm going to give you a date now. I'm saying now you can get treated within 12 months. By 2005, you'll get treated within 6 months.
But it's not been this
2008, it will be
You might not be here in 2005.
My girlfriend's going to have her
It will be
operation by
3
then. Is
months
that
in
what you're saying?
2008. That
So
is your
I can
date,
hold you to
sir.
that.
And
I can hold you to that.
do.
You personally.
I want
Not
you
your
to hold
government,
me
you.
to that.
I'm going to hold
because
you to that
you do.
date.
Because that will happen. Because the investment going in under
Fair
this
enough,
Labour
mate.
government.
So when...
That is happening. That's a cast-iron guarantee, and that is happening.
Come.
You're
No
talking
good
about
shouting
waiting
at me.
months, 18 months waiting less than 12 months. Some people are waiting and they're still not getting it. I've been waiting almost 2 years to have a scan after neurological injury, and I'm still not getting it. I'm still not getting the support or the help that I should be getting.
What are you waiting for a scan for?
I suffered neurological injuries.
You had an accident, didn't you?
Yeah,
You fell off a ladder.
That's right, yeah.
And window cleaning. And you did your skull fractured, what, 3 times, was it?
3 skull fractures,
And
3
pelvic.
hairbrain on the brain, pelvic.
Right. And that, when was that?
Year 2000.
And you're still waiting for scans?
They refuse to give it.
Why?
They say it's cost. I've been diagnosed with sleep apnea, which I have a machine, the CPAP machine, that I have to wear.
This is all a result of the accident?
It is, yeah.
It's a very serious accident.
No, it is.
The actual injury.
Has the gentleman had any treatment at all?
Yeah, I'm starving the brain of oxygen when I didn't use the machine. I had to actually wait, after being diagnosed with it, 5 months before I was given the machine. So I was told by both consultants, this is not good, you're going to get more damage done. How long before the machine comes? 5 months. 5 months I've had to wait, and I am still living the...
These are the repercussions of the accident, yeah.
Of what you're talking about is what's that?
No, I
it
agree,
affects lives.
The mental fear.
Yeah. My kids, my family, they've suffered. I've not been rational-minded sometimes. I'm left to it.
And that's why the money is going in, that's why these times are being compressed.
2 years.
And I agree completely
2 years.
with the gentleman, it's unacceptable. And that's why the
Where
investment's
about
going
is,
in, that's why there's an extra
which hospital
40,000
did you
nurses,
arrive
more
at, please?
operations.
Robert, can I ask the Minister, you say you're bringing surgeons in from abroad to do the operations. Where are you going to put the patients? There are no beds in hospitals now.
Well, who said
Where
that
are you going to put them? In tents?
there's the new treatment centres being set up.
Where?
And the idea...
She's got a point. Hang on, listen to it. Listen,
throughout the country.
Don't fool me. Where are you going to put them?
No, there's treatment centres up and down the country. And the
Where?
idea... Well, everywhere, right?
I'm a
in every major town. Okay?
I'm a doctor's wife. I've been in the health service with my husband for 40 years.
Yes.
You can't get doctors.
You can't pull the wool over her eyes, she's telling you.
You haven't any beds.
No, we
All
don't.
the-
We're getting the
Garen,
doctors
just a minute.
from abroad.
All the surgeries in our area last week, we're told you cannot admit any patients for the next 2 days. We have no hospital beds. There's no flu epidemic. There's nothing. There are no beds.
But there
are no beds, there are no nurses, there are no doctors.
It's like the woman that's had to go 275 miles to give birth from New Haven to Brighton to Manchester, right?
Yeah, you can stop off
It's
at
no good you
Croydon.
bringing the doctor to Brighton. There's no bed there.
There's no bed. You bring the surgeons in.
No, there are a
Then-
number of
just
people
a
in this
minute.
audience who've got individual cases, which I respect.
Garen,
What you're
just a
saying is
minute.
true.
You bring the
But it is
surgeons
the
in.
case. It
Where are you having the
is the case
aftercare?
there's an extra 40,000 nurses. It is the case that we're getting doctors from abroad to come in to do an extra 250,000 of these operations. It is the case we'll have some place to do them. And it
Fine.
is the case.
Doing
What you
the
say is also true.
Let me come back. They're doing the operations. Who's doing the aftercare? You pay these surgeons to come in.
Yeah,
As soon as they've done the operation, off they go.
Look at his face.
Who's
No,
doing
I thought of that.
Just a minute. Who's doing the complications?
There is
Who's doing the aftercare?
What we're talking about here,
You can't answer.
is 250,000.
Aftercare.
Well, can I just
Most
make the point?
important, aftercare.
Yes, I've heard the point. Yeah, it's back-to-back hip operation, cataract operations that you can almost do on a production line to take that heat out of the NHS
You can do
system.
it on a production line till something goes wrong.
And where is the aftercare coming from? Well, the aftercare is coming from
It's coming from the people,
there's
doctors
7.5%
here.
real increase in investment this year, next year, the year after,
You
and there's been a
can't-
6% increase every year since
What about the
1997.
ambulance service? There's been a lot of publicity about the ambulance service.
The money
recently.
is
Is that
there,
letting
and
us
it's
down
happening.
too? Why?
On the 24th of September.
Come on.
24th of September, my fiancé collapsed in my home. I found, at 6:40, I phoned an ambulance, and I was told, be patient, we're busy, we'll be with you as soon as possible. Is he fit? I said, no, he's never had a fit in his life. Is he convulsing? I said, no, he's not. Put him on his recovery position, so put him in a recovery position. We'll be with you as soon as possible. Put the phone down, keep the line clear. They'll put the phone down. I brought him around, stabbing his cheek, and I kept him talking to me. Over 10 minutes and still no ambulance. So I phoned my neighbour, who's also a friend. She come down while I'm looking for the ambulance. Like I said, no ambulance comes, so I phoned up again. Where's the ambulance? We're busy, bear with us. Now, before I phoned the ambulance, he'd actually stopped breathing, and I give him mouth to mouth and brought him back. I informed them this. We're busy, we'll be with you as soon as possible. I said, he's already stopped breathing. Bear with us. I said, can you phone an ambulance again? No, we can't, we've got procedures. He wouldn't even phone for an ambulance again. So I said, he stopped breathing, I'm panicking, keep him talking. Put the phone down, keep the line clear. Which I did again. Another 10 minutes goes by, still no ambulance. So by this time I'm frantic. So I phoned him up again, because he'd stopped breathing, and I brought him back again. And I'm screaming, where's the ambulance, where's the ambulance? And she said, we're busy, we'll be with you as soon as possible. I said, he's already stopped breathing twice, and I brought him back. And then I had to pass the phone to my neighbour, because he was stopped breathing again. And I'm screaming, and she said to my neighbour, tell her to give him mouth to mouth, which she already was doing. And she said she's doing that, and he said, tell her to keep calm, we can do without her getting upset in her condition, because I've got a bad heart. And I said, I'm not bothered about myself, get the ambulance out here.
How long did it take?
31 minutes.
And what happened to your fiance?
He passed away.
All this sheets with all the ambulances are all on emergency calls, and
they were busy. So they were busy, they're saying.
They were busy.
So they hadn't got enough resources to deal. That's what it sounds like. Yeah. Their excuse or the explanation is that they were busy, they were doing other calls just as serious or as important. Do you understand?
That's what happened, yeah, to me. My mum, 23rd of October. She was shopping over at Purley, and she just collapsed. Her legs just went underneath her. And luckily the staff that she knew, because she'd been going into that superstore for years, you know, they helped her. She had a first aid with her. Well, the first call for 999 was at 11:21. The second call, 11:36, which they run back and said there'd be a delay. By then, Mum's going blue in the face, stomach ache, neck pain. Another call went through at 11:40, and then the next one at 12:12. You know, which an ambulance turned up at 12:21, estimated time. And Mum had a cardiac arrest in the ambulance at 12:39 and was dead on arrival. So,
Grant?
Yeah, these are dreadful stories, inexcusable, but it's worth mentioning that the number of 999 calls to ambulances has doubled in the last 3 years to 5 million calls. And it is the case that 3/4 of these calls get there within 8 minutes. This is life-threatening, and 95% within 14 minutes. But clearly nobody can excuse what we've just heard. We've also got NHS direct and walk-in centres, and the problem is that some people, at least, I'm not talking about these awful cases we just heard, are phoning up ambulances when they don't need them. That's why we've doubled the number of calls, and they should have phoned up NHS Direct, who can then phone them an ambulance, as well as a medical assessment. But I wouldn't for a moment say that the last 2 cases that we've heard aren't appalling. But there is a difficulty for the ambulance service that if they double the number of calls in 3 years, and they're still having lower call-out times on average...
Why are they called out to cut fingers?
Well, exactly, that's the point I'm making. Yeah.
You know, why are they called out to smack heads?
Yeah, well, there are issues about what is legitimate use of an ambulance. As you said, so many people seem to be using
Right,
this ambulance
a smackhead will get a red
taxi.
call. A smackhead will get a red call before a person who's worked all his life will actually get seen to any time.
No, I mean, I guess the ambulance service is saying if somebody is in a life-threatening condition, they need to be there, you know, certainly within 8 minutes. Now, I know this wasn't the case of Pauline Lyon,
Is it the case
but
in your
they
case?
can't
No,
say,
no.
well,
8
we're not
minutes.
going to you because
8
you're a
minutes.
smackhead, but the ambulance crews aren't in a position to discriminate between people who are heroin addicts.
Because they do have to determine priority.
They're just going to say, are you about to die? We
I
should
don't
be
know
there.
if you know this, but actually when you do phone for an ambulance, you get through to your phone 999. It's an
Yes.
emergency, and they ask you which service you want. I phoned an ambulance on Saturday night for my future daughter-in-law. She was in horrific pain. She was in bed. She couldn't walk. She had pains in her back. She had pains in her stomach. And there's a possibility at that time that I might have just been getting my first grandchild. She took poorly. We phoned an ambulance. 35, 36, 40 minutes later, the ambulance knocked on the door. When I phoned that ambulance, I told the ambulance, the lady that was taking my call, she asked me how old she was, what was the problem, was she in pain, does she definitely need an ambulance? And I said we'd phoned the NHS helpline, and the NHS helpline advised us to phone an ambulance because there was a possibility of a child being involved. My daughter-in-law went to hospital just after 11 o'clock on Saturday night. At 4 o'clock in the morning, I got a phone call saying she was back home because she hadn't been seen by a doctor. At 4 o'clock in the morning, my daughter-in-law pretended she felt better so she could go home and be ill in private because there was 40 other people in that hospital crying and ill who weren't being treated. After 4.5 hours, she was told she might wait another 4.5 hours because in the meantime, the emergencies are coming into the hospitals, which is understandable. This is accident and emergency. It would only have taken an hour if the hospital down the road, which was a mile away, hadn't closed their accident and emergency 18 months ago. She would have had the choice to go to 2 hospitals.
So it's not just getting the ambulance, waiting an hour or 40 minutes or half an hour. It's when you get to the hospital. Are there problems with accident and emergency units then?
Yes, there are. My mother, I was called to my mother's old people's home by the warden and to say that she was in a lot of pain, and the ambulance arrived. I went with the ambulance to the accident and emergency. She was wheeled in to a corridor. She was screaming in agony, absolute agony. Then the place was absolutely full of stretchers, people. One man next to my mother said, I haven't had anything to drink or eat for 11 hours. I've been lying here in the corridor. My mother then was screaming and screaming, and the nurse came along and said, we'll give you a morphine injection. It was red alert, red alert. The nurses were running and running and running. So she never got a morphine injection. She came by again. She said, I will really try to get you the morphine injection. And she got it. And then 2 hours later, she wanted another injection. This went on all day and all night, and all to the next day. She lay in the corridor. She had a small screen put round her and a catheter was fitted inside her in the corridor with all these people. We were put in a small cubicle that night, which was part of the ward. There was dry toast on the floor. There was blood on her bed, on the floor. The toilet was covered in blood. It was in the hand basin, the toilet. And there we stayed, and with her screaming in pain. And the next day, that night, the doctor came round and he said, when you all go home and this is over, I want you all to do what you can and tell the public. Go on television, write in the papers, don't just accept what is happening here. And the nurses were absolutely brilliant, but they're just worn out. They could not cope with what was going on and how people were shouting at them because they were distraught, they were worried about their parents and family. How can we allow this? It's a third world, and we're not a third world.
It's worse than third world. Actually, what's
Accident
happened...
and emergency. Accident and emergency.
It's worse than the third world. Actually, what's happened in the last few years,
You had experience
Patients
of
coming
it?
from outside, I did. By other doctors, GPs, etc. He's there, he'll tell you. Have to now go through accident and emergency or medical admissions ward.
EBS, yeah.
Right. Medical admissions ward normally is closed. So they put in trolleys in accident emergency. On top of that come all the emergencies, as well as the other patients. My husband is a doctor. He had a severe nosebleed, which we couldn't stop.
The doctor?
A doctor. Severe.
Well, he couldn't stop his own nosebleed?
No. We tried. Otherwise, we wouldn't have gone to accident and emergency. He had to sit there for 3 hours, whereas he was vomiting blood. It was running down his front of him, back of him. I was cleaning blood off the floor. There was a whole canister full of thing. I asked them 3 times to get someone to plug my husband's nose. Nobody bothered. Next thing, my husband got up, he walked out and he said, "What am I to do? Bleed to death here before anyone sees to me? Is this what happens to me? What's happening to my patients?"
Yeah.
Right? And this is absolutely true.
Doctor?
Yes. I fully appreciate what you're saying, you know. The load on the A&E is
It's tremendous.
tremendous. You just cannot cope up.
You can't cope.
Even the
But that's you're part of the problem, aren't you?
Well,
come on.
no.
If I can't see you for 5 days, doctor, I'm going to waltz off to A&E.
Well, obviously, that is, you know, I tell you,
Not in our area.
it is basically the government's problem because the policy is not right.
No.
We have to have more GPs, more funds in the primary care. There are a number of things which we can care in the primary care.
But is that part of the problem, that because people are
It is.
having difficulty seeing you, or
Yeah.
people like
Yeah.
you, even if it's not 5 days, even
Yeah.
if it's 48 hours, they'll turn up with what is reasonably, a relatively trivial, I'm not saying a trivial complaint, but a relatively trivial complaint that you could easily have dealt with had they been able to see you. But because they can't, they turn up at A&E and they stop the more serious cases
Absolutely.
being seen.
I can just give you a small example. I work in Hounslow. In that area, about 6 GPs have retired or died in the last 18 months. And except one, none has been replaced. Because there is no doctors are available. Yeah, GPs. Yeah.
There are
So-
no GPs.
And no, even the doctors are there. They don't want to go into general practice. That's the thing, you know. It's so much of frustration.
Could I just say that just run a little comparison in Belgium, I can see my GP within 2 or 3 hours. If I had to have a hysterectomy, fortunately I don't. So
hang on. As the equivalent of an NHS patient, you could see him, not paying, because we can all see somebody if we're paying, because you know, it depends on how much you pay. But you could go and see your Belgian doctor within 2 hours.
Absolutely. I could call him 3 o'clock in the morning, and I've done so on a Sunday on his mobile phone, and he'll be at my door in 20 minutes.
That's quite right.
At 3 in the morning on a Sunday.
Right.
But
How many patients does he look after? How many patients does he look after?
With a major operation, I can have a major operation in 2 weeks.
No, tell me one thing. How many patients does he look after?
Paid.
Yeah.
How many patients does he look after?
I imagine not as many as you look after.
Exactly.
I imagine that
you see, the main problem is...
But that's what we want.
Yeah.
We want you treating fewer, and then we could have you doing another job.
Exactly.
Geraint?
Yeah, no, there's 2 quick points. One on the last point, the Belgium service is better because they pay much higher tax rates and a much higher proportion of their GDP goes into health. Now, if people want that, they can vote for that, but there was enough complaints when we introduced a 1p in the pound as opposed to 10p to get out to those sort of levels. We are investing more, and I respect the examples that were given on A&E. There are problems in certain areas, but for example, we're employing an extra 600 nurses specifically on A&E now. There's much more streaming, as you'll know, to prioritise cases, and 9 out of 10 people are seen and treated in an A&E within 4 hours and are transferred through.
But I don't pretend. He visited to his problem. He falls off a ladder, right? He fractures his skull 3 times and his pelvis, right? And he's go
12 hours laying there. No medication given because of the neurology.
This is what happens to him when he gets to A&E.
I was screaming, crying and everything. Nothing.
No, well, that's disgraceful. When did that happen?
Sorry?
When did that happen?
Year 2000.
2,000. Now, I mean, the situation is getting better all the time. I don't try to... There are a lot of individual cases here of horror stories, and I sympathise with them all, and they're all true, obviously. All I would say is, in the main, if 9 out of 10 people are being seen in A&E and passed through and treated within 4 hours, we're beginning to get there. And if it is the case, as it is, there's an extra 600 nurses this year in A&E, and we're streaming people to prioritise one above the other, then we're beginning to make progress. But I'm not pretending it's not perfect, and I accept what people are saying.
No, I think even physically...
When I was there,
sorry,
a child came in seriously injured. I was left to be cared for by my wife. No one else, no nurses. I was left to because they hadn't the staff. It was either a case of, you're going to have to sort him out, or we have to sort the child out. And that was it. And my wife was left to him.
Yeah, that's just
she suffers now, the nightmares and stuff like that.
It is changing.
Hang on, Frank, please. Can't hear from there.
Can I also say it's not just one problem? You shut all the small cottage hospitals up.
Yes. Yeah.
People are coming from miles and miles to one hospital. Where I live in Oxford, nurses cannot afford to live. The expense of the housing is so big. So where are you going to get your nurses?
Oh, it's the same problem. Social
Yeah,
housing.
well,
You need more social housing. We're talking about multiple problems here with the NHS, with people having horrific experiences with ambulances and accidents and emergency and waiting times and pain. We're actually doing a totally different programme on having different fathers in the same family. If you've got 4 or 5 kids by 4 or 5 different fathers, how do the kids manage? We want to deal with how they deal with having lots of brothers and sisters, half-brothers and sisters, and dealing with 4 or 5, 3 or 4, 2 or 3 different fathers coming in and out of the household. Does one child get treated very well by a father who he sees regularly, and another child who has a different father hardly see them at all? Does that cause problems between the kids? Are you one of the kids? Are you the father? We'd like to hear from you. That's if you're a mother with children by several husbands, if you're a child living in a family where many of you have different fathers, and if you're the father who has a child by a woman who also has lots of other children by a lot of men. What kind of problems, difficulties that... It's really complicated, this, isn't it? We'd like to hear from you. 08705 100 771, or you can email us. Do you think we expect too much, perhaps, from the NHS? No. Grant is saying, quite truthfully, rightly, though there is also massaging of the figures going on, but, you know, the government is investing a lot of money. Of our money, we've paid a lot more in taxes to be ploughed back into health service. Are we expecting then, perhaps, it does things it can't be expected to do?
No. Our son was born with a condition, was called pulmonary stenosis. They did a balloon in 2000 in January to relieve the stenosis. We actually signed a consent form. We got to theatre before they ballooned, and they said, would you sign again? We was a bit worried. Why? They never explained. They just said, we need to look at back of the heart. We signed again. He came from theatre, had the balloon in. They told us they found a small piece of skin in his heart. He would need open surgery soon. He had the open heart surgery in May 2000. I got worried because I didn't know what this piece of skin was, so I did my research. They said they'd actually removed this piece of skin. He was fine. I did my research, went to my GP, got the name of this condition. It was called subaortic stenosis. It's a growth below the aortic valve. So I got suspicion. I thought, no, and I'd done my research and I realised I hadn't removed this growth.
Because he was showing signs of becoming more severe.
Yeah, like he was before the open heart surgery. So what we did, we got on the internet, we found a hospital in America, Miami Children's, and they asked us to bring him over because I was worried. We brought him over July 2001. They confirmed our worst nightmare. They said, your son's still got this growth, it's quite large, he needs a cono procedure and a prosthetic valve put in. His valve's badly damaged. So we said, OK, could you, we will lose our son. And he said, no, he's quite, he's done these procedures, he hasn't lost the patient. So we came back and we asked the National Health if they would pay for our son to have his open heart surgery.
The reason they was asked to pay for the operation were...
Could it not be done here?
No.
No, it could not be done here.
So this is something we're not capable of doing. But they could do it in America, and it's a reasonably safe...
It's unavailable here.
...procedure.
The statistics are very good.
So the NHS did pay for you, didn't they?
They did at the end of the day.
How much?
It was supposed to be $50,000.
Yeah.
But when we took him last year for his open heart surgery, a 10-hour open heart surgery, 400 stitches in his heart, he had to have his heart rebuilt. Now, I'm really upset. No, the bill what came afterwards to our house was $280,000. I gave it straight to the National Health. I don't know what they paid, but I know they paid the money. We actually had another meeting.
That must have been a shock, though. I mean, you're obviously still worried about your son.
We are
and
very
you get a bill
worried.
for... Well, at the time you got the bill, and you get a bill for $280,000.
We tried to fundraise. Nobody would help us.
But anyway, that was paid for, as far as you know, that's been paid for by the NHS.
It has.
So you know, you were treated very well by the NHS.
We was, after our struggling and fighting them and proving that this is the procedure he needed at his first open heart surgery.
But then your son is very lucky to have you as parents, isn't he? He's very lucky to have her as a mother who goes on the internet, gets the research, finds out, she becomes more knowledgeable, more intelligent than the doctors here. Well, it's not... But to be fair to them, if they don't know about it, if they haven't operated on it, they can't know what they don't do. She only found out because we do it in America. The fact that the NHS then paid for you is a good and proper thing for it to have done.
Wonderful at the end of the day, thank you.
Very appreciative.
But, you know, we had to struggle and fight and prove. We know that our son needed this procedure in the UK 2000, not... You know, last year it should have been before.
What price the scales like?
Exactly. Right.
No, it's paid the price, absolutely.
Yeah.
Do we expect too much?
I don't think expect enough. I don't see why our children, our future, can't be treated. You're saying statistics are 31 people.
But they have treated her. They have treated her. They're paid.
This lady, and I'm very happy for that lady. I really am. I don't agree with the minister. The 31 people that he's stating is waiting on a list. My daughter's been waiting since June 2001, 6 months to see a specialist. She was told she would get her operation. She's got scoliosis in her spine. She was told she would get done within a year. Her operation is exempt from waiting time. It's up to whoever to decide when she will get operated on. All the time her condition is deteriorating, and that affects the whole family because it's such a complex operation. If I'd needed a hip replacement, I'd be done in 6 months, but my daughter needs her spine fixed, and it's whenever she can get that operation. There's not enough specialists, and this is your future.
Oh, it's because we haven't got enough specialists?
No, there's 2 specialists in Scotland. There's only 2 specialists in Scotland.
Because it's a rare
It's not rare, it's very common.
Is it very common?
It's just we don't have enough specialists to do the operations.
And what about in England?
They've got all the specialists.
Well, why can't you
they've got more specialists in Scotland.
Well,
They won't send you because you've got a specialist in your area, and you have to wait on that waiting list.
So you've got a specialist in your area in Scotland, and you're having to wait a long time. But there's other specialists in England. If the waiting list is...
They won't send you down.
Yeah, they can go. It's called an... I don't know about Scotland and England, mind you. That's a bit of a difference because they've got a different system now, haven't they? They've got their own parliament grant. They've even got...
Yeah, that's right.
They have advantages because they pay for the care of the elderly in nursing homes where we don't. But is this because she could come to an English hospital and get treated?
Well, clearly I'm sure everyone agrees that she should. She should be treated in England as soon as possible. Self-evidently.
But why haven't I?
So she could get know the answers. I mean, I can't come on this show and talk about these individual cases. Everybody would agree here that if someone can treat you earlier, you should be treated.
Anthony, do you think we're expecting too much of the NHS for it to be able to do everything, every speciality, every single thing?
I think we are.
Anthony?
To a degree, yeah. I think circumstances like NICE, when the National Institute of Clinical Excellence was started up, they took far too long over beta interferon, 2.5 years. I've missed the boat. The criteria, I was fit. I could pass the criteria.
You've got MS.
Yeah.
And you've been denied beta interferon.
I have. Yeah.
But for clinical
reasons. A year
reason.
ago, I could have passed the criteria.
But so.
Obviously, it's a multifaceted, deteriorative disease, and I'm afraid I've missed the boat.
Why have you missed the boat?
Because I'm unable to walk 10 yards now.
Oh, the criteria for whether this thing can help you medically is that you've got to be able to walk 10 yards.
Yeah.
But then they're saying, aren't they, that it can only help people who can walk 10 yards, so it wouldn't be worth giving to you.
But I could walk 10 yards a year ago.
OK, so if they'd have made their decision a year ago, but we can't blame... Can we?
Nice
it's like, in a way, Anthony, it's like saying they hadn't discovered how to do open heart surgery 20 years ago. Well, if they hadn't discovered it 20 years ago, we can't blame anybody for that, can we? No. So can we blame anybody for NICE not making...
It's been licensed since 1995, 95, yeah.
Do we expect too much doctor from the NHS?
Was it the hospital which refused to give you the beta interferon?
Yeah.
They did.
They did.
Right. I mean, basically...
But it was after the National Institute for Clinical Excellence
Yeah,
they actually laid down the
nice
criteria.
guidelines, yeah.
And if you remember, they'd actually established that it was
2.5 years.
It was efficacious
It is.
for some people, but they determined who it was efficacious for, didn't
Exactly. Otherwise, there's no point wasting the medication.
Right. And
which is,
he didn't come across the line, yeah. Do we expect too much? Do you feel that people put too much demands?
I think it is true that, people's expectation is too much. And
in what way?
In all way. I mean, time factor, they want everything to be done straight away there and then. And they even come for very, very trivial things which can be managed very easily elsewhere.
Such
and
as?
I think basic thing is that health education should be done. I mean, there's no health education. People sneezing in the morning comes to the surgery and they want the child to be seen. And it wastes my 15 minutes, 10 minutes of my secretary, 10 minutes of my nurse.
Yeah, but if you've got a child...
Well, I know.
I mean, half the thing with doing that is actually you are doing a very good thing. The child might not be ill, but you are reassuring the mother.
Well, yes,
Isn't
exactly.
that important?
But the thing is, we have to have some paramedics, more paramedics, like healthcare advisors.
Oh, you want to
healthcare-
delegate?
Delegate something. I mean, we will be there. We are there anyway. We are seeing more important patients on whom we can do our.
So what are you going to be doing, doctor? So we've
Seeing the
delegated
patients.
all these people to the paramedics. Then you've got the nurses. Then you've got all these receptionists. Half the people in your practice are going down to A&E. What are you going to be doing? Playing golf?
Not really. I wish I could go and play golf. I would wish to. But honestly, at the moment, with the pressure we haven't got any time. Of course,
indeed,
and there is
may I
one thing
say-
I must confess. The amount of paperwork, the bureaucracy is also coming into picture. We get so much of paper. I mean, and obviously most of the things we throw in the bin, but still, we have to do all the paperwork.
Well, I'm an ex-A&E sister, and while I agree with a lot of what's been said here, I have severe food intolerance. At one stage, I could only eat tropical fruits and lamb, nothing else at all. And I have been refused treatment by the NHS.
Why?
Because there is nothing that they can do for me, although there is a treatment available to other people in this country.
Where?
At the Royal Homeopathic Hospital. Other people are getting it on the NHS, but I am
Referred
not.
to that hospital?
Yes.
All right. So the NHS doesn't provide it, but if
Yes,
it were...
yes, the NHS provides it.
No, but not in its hospitals, but it will pay for, as it were, a treatment at the homeopathic.
Well, that is the National Hospital.
It's a national hospital.
Yeah, it's an NHS hospital.
Yeah. But that's down to your doctor, isn't it, to determine whether you're...
No. Well, my doctor applied for funding and it was refused.
But why would it be refused?
They said there were no... Now, what was the expression?
No good reason.
No. It was,
I think, was it the term
grounds of
ECT,
efficacy.
extra contractual contract? I mean, I have come across, you haven't got the contract
we've got
with that
a bit of
kind
bureaucracy here now.
It is, it is.
Yes.
Well, then it's an extra, it's outside your contract.
Exactly. So if you don't come in that category, now I can't refer any patient back to a homeopathic hospital, where I used to do. And I've got still many patients who are being treated in Royal Homeopathic Hospital, but now onwards from last year...
Well, you can't do that now.
I can't do that.
Why?
I don't know.
But you've got a contract, a GP contract, have you?
Yeah.
So you've got control over your own budget?
No.
Not really, no.
It's
What it is, the health authority has got contract with certain hospitals.
Right.
And we can refer only to those hospitals.
To those that it's contracted
You can't go out of that.
So that local authority, her local authority,
Again,
has
comes to
actually
bureaucracy.
decided they don't want a contract with the homeopathic hospital.
right.
So it's not available to us. So we've got a bit of a postcode lottery here. I thought we'd stopped all that.
No, we are. I mean, may I just say, as people are growing older and technology moves forward, there's more and more expectations and demands on the health service. That's why we've got 20 million people using NHS Direct. And what the doctor's saying on that is right. And we're trying to keep up with this increasing pressure. But on the postcode lottery, as the gentleman there said about beta interferon, the National Institute for Clinical Excellence decides from time to time what drugs are available, and you've got a right to them. So recently, for instance, 30,000 people now have got rights to various new cancer drugs and beta interferons moving forward. I know I respect
You've got to be very quick, Pete. Very quick.
Excuse me, my daughter's been diagnosed with spinal muscular atrophy at the age of 5 months. Our consultant told us that she was terminally ill, OK? Why, in another country, is this not classed as a terminal illness? Why can they help these children, but they refuse to help us? It took me 3 attempts to go and see my consultant to get something done. In the end, I took a social worker with me yesterday to see the consultant. It was only when I had a professional in the room did she change a tune and said the equipment I need that's going to cost me in excess of £10,000 because they won't provide it till the very last minute. It's no good at the last minute in case my daughter's going to die.
But you can get this elsewhere.
I can get the equipment, but they won't give it to me. They know my daughter needs it, but they won't give it to me until she's actually been in hospital and needs it to save her life there and then. Why not do something earlier to actually prevent that from happening in the first place?
Leslie! Go on, Colin. Colin. Hang on, Colin. What were you going to say, Colin?
What I was going to say was that I've heard some really, really horror stories here today, but I suffer from prostate cancer, and my treatment has been fantastic. My GP, absolutely brilliant. He discovered it within a very short time. I was seen, and I've been to the Royal Marsden, a wonderful, wonderful hospital.
So you've got nothing but praise for
I can what I believed, and having come here today, I'm not too sure now, but what I believed was that the NHS was there for you when you've got a really, really serious problem. But it obviously...
Well, every problem. Yeah, it's there for you. It's supposed to be there for you wherever you are, treated equally, fairly, free, at the point of need. And if it isn't, then you've got to do something about it. You've either got to be prepared to pay more, or you've got to make sure your MP knows about what's happening in your area, if he doesn't know already. Speak up for yourselves and take care of yourselves. Were you raised in care, lost touch with your family and want to be reunited with them? Call us now, 08705 10771, or email us. Perhaps it's your mother you'd like to meet, your father, your siblings, or a friend you are trying to find. Did you place your child in care and now want to find them? Do you think the past is best left alone? Don't want to disrupt your life? Give us a call too if you've been reunited already.
Up for sale next on BBC One, Homes Under the Hammer.